I'm Dr. Randeep Guleria. I'm currently the chairman of Internal Medicine, Respiratory Disorders and Sleep Disorders at Medanta, the Medicity, Gurgaon. Before this, I was the director and CEO of the All Indian Institute of Medical Sciences, New Delhi. So when we start looking at medicine and we start looking at medicine, both the modern medicine and traditional medicine in terms of Ayurveda, homeopathy and various other forms of traditional medicine, there is good in all of them. The only issue is that we need to have good scientific data to support what is Ayurvedic medicine, the drugs that we use in Ayurveda. At AIIMS, we were doing studies on yoga, and we showed that it was very effective in a large number of diseases, whether it be strokes, whether it be migraine, respiratory diseases, cardiovascular diseases, and that was something which was based on scientific data and was therefore becoming a norm in terms of yogic practice along with modern medicine. When it comes to education, even if we have MBBS, we could look at elective courses, and if someone is wanting to really get some knowledge of Ayurveda or yoga, he could take an elective course on Ayurvedic medicine, yoga, other alternative medicines. He could also take an elective on, say, biomedical engineering if he wants to start some new innovations or have a startup or become an entrepreneur. He could also take an elective on humanities. So, I think we need to start looking at medical education out of its silos and in a broader perspective, where one looks at different specialities also coming in and having more integration with not only medical specialities, but with science, with computer sciences, engineering and others, so that that will make it more comprehensive. And we are seeing a lot of new devices coming into medicine. AI is coming in, big data analysis is coming in. So, I think doctors need to be trained to some extent if they are keen on this, and this can be done by offering electives as far as medicine is concerned. So, to do all of this, we need to have a good legal framework. It's both in terms of what individuals want to do in terms of their practice, what they want to do in terms of research, or even in terms of an IPR policy. If someone wants to have a patent, how does he go about in terms of medical devices or something that a student or someone has done. So, I think there is a need to develop a legal framework both in terms of the practice of medicine and also in terms of how we can push for more, let us say, make in India entrepreneurship, which is something that would be very useful. When we talk of medicine, I think the doctor-patient relationship is very, very important, and what really lies in its foundation is the fact that medicine is not only a science, it is an art also. So, we have made huge progress as far as the science of medicine is concerned, new devices, new drugs, new innovations. But at the same time, we have to make our doctors also aware that the art of medicine is equally important. How do you connect with your patients? Empathy towards your patient, trying to understand the fears that the patient has, talking to your patients and understanding what they haven't told you but are wanting to tell you. So, being able to understand between the lines and also understand their expressions. All of this is the art of medicine, and the art of medicine is very important, and I think it's as important as the science of medicine. And if we are able to follow the art of medicine, I think the doctor-patient relationship would be much better, and we could make it even better in coming days. So, this is something which is a little bit of a dichotomy. Health is a state subject. A large number of policies are rolled out by the government at a national level, and we saw this also during COVID, that very often there was a discordance between what the center was saying and what states were doing, and therefore there is a big debate that should health be a state subject or should it come into the concurrent list of being something which is run by the center. I think this will be an ongoing discussion, but as of now it is a state subject, and there has to be good coordination between the center and the states in terms of providing quality health care to all citizens. Because of this, we see a diversity of health care in our country. We have certain states which provide high quality health care even in rural India, and there are certain states where health care is not as good as we would want it to be. So, I think really if we want to sort of have an even sort of health care to every citizen, irrespective of which state or which region he belongs to, one will have to look at some sort of a policy decision as far as this is concerned.